Good afternoon, everyone. Welcome to the MDG 500 Google Plus Hangout. I'm Chris Helfrich. I'm the director of the UN Foundation's Nothing But Nets campaign, the world's largest global grassroots campaign to fight malaria. August 18th, 2014, today, marks 500 days until the deadline for the United Nations Millennium Development Goals, the world's to-do list to improve our lives and alleviate poverty all over the world. Today, the UN Foundation is convening partners and leaders from around the world to reflect on the progress that we've made, celebrate our collective success, and discuss what still needs to be done to make the world a better place. Now is the time to recommit to doing everything we can to build momentum in these final 500 days and beyond. The progress we make now will make a difference in the lives of millions of people around the world and lay the foundation for our future efforts. Let's use the next 500 days to make every day, every action, and every life count. Today we've been called by our UN partners and experts to take part in a discussion around the progress that's been made towards Millennium Development Goal 6. Combating malaria, HIV/AIDS, and other diseases. We've got an incredible collection of panelists, and I want to introduce them very quickly. I'm joined first, and maybe you could just raise your hand when I call your name, by Rear Admiral Tim Ziemer, who is the U.S. Global Malaria Coordinator for the President's Malaria Initiative. Next, I'd like to introduce Christoph Benn, who's the Director of External Relationships and Partnerships for the Global Fund to fight AIDS, TB, and malaria. Welcome, Christoph.
Thank you.
We have Valentina present. Valentina is the Global Malaria Advisor for UNICEF and comes to us all the way from Madagascar today. Welcome, Valentina. And we're joined, last but not least, by Alan Court, who's a senior advisor in the Office of the UN Special Envoy for Malaria. So I'd like to remind anyone who's listening to this conversation to please join in to what we're doing on Twitter and using the hashtag MDG Momentum. Again, that's hashtag MDG Momentum. And to quickly recap MDG 6, I want to talk very, very briefly about the details. Target 6A of MDG 6, the goal is to have halted by 2015 and begun to reverse the spread of HIV/AIDS. Target 6B is to achieve by 2010 universal access to treatment for HIV/AIDS for all those who need it. And Target 6C to have halted by 2015 and begun to reverse the incidence of malaria and other major diseases. And there is a specific malaria, I guess there's a greater collection of malaria experts on this panel, though the conversation will encompass all of MDG 6, but to talk about some of the progress that's been made so far, I think that's a critical jumping off point for us. In terms of malaria, over the last decade, we've reduced malaria mortality amongst children under the age of 5 by nearly 50%. Since 2000, global efforts to fight malaria has resulted in 3.3 million lives saved. 52 countries are on track to reduce malaria incidence by 75% in 2015, and in sub-Saharan Africa, bednet ownership has risen from 3% to 54% since 2000. Some amazing progress. In the HIV/AIDS space, antiretroviral therapy for HIV-infected people has saved nearly 6.6 million lives since 1995. 6.6 million lives. AIDS-related deaths are at their lowest since the peak in 2005. Having declined by 35%, and new HIV infections among children have fallen nearly 60% since 2001. And lastly, with regards to tuberculosis, since 1995 efforts to fight TB have resulted in saving an estimated 22 million lives. There's been a 45% decrease in tuberculosis deaths since 1990. So these statistics are big and they're unbelievable. And part of what we want to do today, beyond the really impressive statistics, is to maybe help share some of those stories. But at Nothing But Nets, where I'm the campaign's director, we're a proud and committed partner in this fight to achieve MDG 6, and specifically in our case to help fight the spread of malaria. Nothing But Nets specifically has raised more than $50 million and delivered more than 7 million nets since this campaign was founded in 2006. And in that time, we've delivered over 1 million nets to help refugee populations throughout Africa, bringing malaria from the #1 cause of death amongst refugees down to #5. In these next 500 days, Nothing But Nets, we're committed to distributing an estimated 500,000 bed nets or more to help our UN partners and other organizations. So that's almost 1,000 nets every day. And we have hundreds of thousands of grassroots supporters and partners all over the world who are raising awareness, raising money, and advocating to help us fight malaria. These 4 panelists I'm joined with represent some of the biggest and best partners that we have, and who we're working side by side with and funding, and whose work we're advocating on behalf of. And so that's it for me. I'll ask a couple of questions, but I want to turn it over to the stars of the show. And my first question, and I want all of you to weigh in on this, but let's start with Rear Admiral Ziemer here. There's been so much progress that's been made in the fight against malaria and these other diseases. What's one story of success that strikes you every time you look back on what's been done and what's been accomplished?
Thanks, Chris, for hosting this. I just want to acknowledge your leadership and the leadership of the UN Foundation in putting together this event, but more importantly, the role that you have not only as advocates, but actually participants in this global malaria fight. I am just really grateful to be partnering with you and other members of the UN Foundation, and to join the other 4 colleagues on this panel as we discuss this very significant point in time when we look at where we've been, where we are, and where we need to go in this malaria fight. It's truly, as you mentioned a few minutes ago with the statistics, this is a good news story, and an awful lot of progress has been made. It's easy to think big, but it's more compelling when you think about personal experiences. You did mention about lives saved, and when you look and when you consider that almost 70% of those lives saved, that 3.3 million figure that you threw out, came from 10 of the most endemic countries in Africa. And when you visit those countries and walk into a hospital ward and a child infant ward and see the beds virtually empty as compared to what they were 10 years ago, it makes a huge impact. And I would say that experience alone, walking in to hospitals and clinics and community health huts and see the significant drop, that itself is an incentive that we've been on the right track, and we have a great mission. The sobering fact is, Chris, is that this year the estimates are 660,000 people are going to die from this preventable disease, and so there's a lot of work to be done.
Valentina, you've given your life to fighting malaria with UNICEF, and what is that one thing that that one story that, when looking back, strikes you, that amazes you in terms of the progress that we've made?
I would add to Tim's point, which is that amongst those 3.3 million lives saved, 90% of those, so about 3 million of those, were actually in children under 5 in sub-Saharan Africa. And that, for us, especially for me working for UNICEF and for my colleagues, is what makes this really worthwhile, because it's MDG 6, but MDG 6 also, as it contributes to MDG 4 and MDG 5. And we're really seeing that making these inroads against malaria makes the inroads against child mortality and maternal mortality. And that, for me, is extraordinary. And if you look at it from the point of view of a country that no one expected to get very far, so the DRC in 2004 distributed about 700,000 bed nets, which is almost nothing in terms of the protection needs that it has. In 2011, that was 17 million bed nets. And so that, for me, has been extraordinary, that the scale-up, the financing that has been contributed by the Global Fund, by PMI, by advocates such as yourself, is really making an impact on the ground. And for us, what's most important is that it's really making an impact for children, who are the most vulnerable and the most at risk.
Yeah, no, thank you, Valentina, and I think that's a good point. Alan, do you have anything you want to add on in terms of, when looking back, what's one of the biggest things that strikes you?
Sure, Chris. You and Valentina both triggered something in my mind, and that is, you mentioned 7 million nets distributed by the UN Foundation. 10 years ago, that's the total number of insecticide-treated nets that were manufactured in the world. So that's in 2004. In the first half of this year, from January to June, over 100 million nets were manufactured and delivered. That's a phenomenal increase in 10 years. And almost 2 people can be protected by that for each net. So the world has come a long way. As Valentina says, the funding has been remarkable, and you can see the rise in funding has tracked the rise in lives saved from nets, from treatments, from spraying, and from other events. The same you can say for in HIV, for the program for preventing mother-to-child transmission of HIV. That's been tremendously successful, and you can track it with the increase of funding, the simplification of medication over time, and the focus that's been given to this. The undivided focus and attention that's been given in the 22 countries with the highest burden of mother-to-child transmission. So the 2 things, the massive increase in net manufacture, distribution and use, and also the massive increase in funding, both for malaria and HIV, and we can see the impact. And as Tim said, it's a good news story.
Yeah, it is a good news story, and I think you segue nicely into asking the same question to Christoph, who represents the Global Fund to fight AIDS, TB, and malaria, and so the scope is broader. And so, Christoph, I don't know if you want to talk about malaria or a success story elsewhere, but can you weigh in here too?
Sure. Thank you, Chris, and it's really a pleasure to be with you on this panel, the virtual panel. And I'm happy to talk a little bit about all 3 diseases, if you don't mind.
Great.
And I mean, you've mentioned already very, very impressive numbers in your introduction. You talked about millions of lives saved and about reductions in incidence and mortality. And anybody who understands, even vaguely public health knows that this is huge. And in a few years' time, to reduce mortality, to reduce diseases like that, it's absolutely impressive. But it's even more impressive for me when you see that on the ground. And before the MDGs were established in 2000, I used to work as a medical doctor in a rural hospital in Tanzania, and the situation was desperate, just desperate. Every day, every year, the numbers of people affected by HIV, TB were going up. We saw countless people die. There was no treatment available. And for malaria, it was the most common cause of morbidity in that region. And we were treating children every day, and knowing that even if we could cure them, they would come back after a couple of weeks with the next malaria. And now to visit the same regions and to see that not only do clinics have drugs and they can treat people affected by HIV and by TB, but you visit the villages and you see really that the families have now access to these bed nets and they are effective. And it has given people hope. There's a real change in how people look at life. There was desperation and now there is hope. And the people have realized that the world does care. That many people around the world have listened, and that we are now working together hand in hand to change the situation. So I think the best is always when you see what is happening and how it is really affecting the lives of millions of people around the world.
Sure, and Christoph, there are exactly 500 days now until the target date for the MDGs, and I'm hoping that you can speak to what the Global Fund is going to be doing in the next 500 days to help us reach our targets, and what the future looks like beyond December 31st of next year.
Yeah, sure. I mean, the Global Fund's role in this fight and in the struggle to achieve the MDGs is to provide financing. To make financial resources available to countries that cannot afford to finance these programs by themselves. Together with many of the partners here on the panel, particularly with PMI, with UNICEF, and with also with you, with UNF, and we've been partnering for many, many years in supporting these programs. So we will try to kind of really accelerate the finances, and thereby making the tools available in the hands of people so that people have access to not only the bed nets and prevention, but also to diagnosis and to treatment. And a lot has happened there as well. Over the last 10 years, we have much better tools now to diagnose malaria correctly, than to treat it if necessary, and to prevent it. So for all three diseases, the Global Fund, after its recent replenishment, can say we are making roughly $16 billion available over the next 3.5 years for countries around the world. But as we will probably also discuss on this panel, it's not just the money. I mean, the money is just a way kind of to make all these drugs and bed nets and other commodities available and get it to the people who are really most affected. And so the main question for us is, how do we make sure that, in the poorest countries with the weakest health systems, in the fragile countries after conflicts, that really we reach the people in the remote areas and the most disadvantaged people?
Sure, and Tim, and I'll let Valentina and Alan weigh in as well. For you guys, fairly specifically, what does the next 500 days have in store in terms of what the President's Malaria Initiative is working on, as well as UNICEF and the UN Special Envoy's Office specifically fighting malaria?
Yeah, Chris, I think that's an important question, because it's what do we do now and what do we do in the near term. I am a strong supporter of these milestones, if you will, in the timeline. 500 days is important because it represents not an artificial goal, but a tangible goal that we can measure. The United States government is totally committed to maternal child health and malaria. It's part of our foreign assistance strategy and commitment. We're committed to the Global Fund as a major and the majority donor. And I'm just grateful for the strong political commitment that President Obama and our Congress, in a bipartisan way, has committed funding to address malaria, maternal and child health, and HIV. So the good news here is that we have strong political commitment, and we're looking at and partnering with trying to make as much progress between now and the next 500 days to achieve the Millennium Development Goals. But I think it's important that we walk away from finances and targets. This is all about improved communities and saving lives and making a better life for our mothers and children and communities. And I think that is the incentive here. Anything we can do by partnering better, to using the tools that we have, or trying to recruit new tools to bend that curve, to accelerate the progress towards more lives saved, is the right thing to do. The United States government is committed to that, and the President's Malaria Initiative is a major part of the engine in our commitment to achieve progress in the next 500 days. It's something that we understand, it's something that we can measure, and we're totally in.
Great. And Alan, I mean, for the Special Envoy for Malaria's office, talk about how you guys are seeing the next 500 days and the work that you're doing.
The most important thing, Chris, is that we don't leave off the effort. We don't take our foot off the gas pedal or the accelerator. We have to continue. The moment you relax, the moment there's less funding going in, the moment people pay less attention, there'll be resurgence. We've seen this happen a couple of times over several decades in Sri Lanka. We've seen this happen more recently over the past few years in Zambia and Rwanda. Fortunately, the governments have intervened and the international community has supported them. So we have to keep the focus, increase the focus, but also work with endemic countries to find out how to better budget, to better cater for the budgeting requirements for increased coverage, while the world looks for the new tools that will break transmission and seriously reduce malaria, which will take longer than certainly the next 500 days,
Sure.
and probably longer than the next 15 years. So the focus for now is maintain the effort, maintain the intensity, find the funding coalitions that will support this, and work with governments so that at the back end, governments themselves can increase, or these endemic countries can increase the amounts of resources they can put into this and control the disease itself before it can finally be eliminated.
Yeah, thanks, Alan. I think that's really important. Valentina, can you speak to UNICEF, who's one of the world's great malaria partners? Can you speak to what the next 500 days, hold for UNICEF's plans in fighting malaria? And also, I want to point out again, you're on the ground in Madagascar, which is obviously a malaria endemic country. But maybe you can humanize a little bit also what these, the importance of these next 500 days and beyond, and the impact that has on individual lives.
Thanks, Chris. So for UNICEF, it's really about working on the ground, as you say. I'm lucky enough to actually be here, to actually be working with the partners on the ground. And it really is about partnerships with the PMIs, with the Global Fund, with the World Bank, all of those who are helping us with the money. But for us, it's about an equity agenda. It's about getting that last mile. It's getting to that most marginalized child. It's the one who has the least access, the most vulnerable. And so for us, the next 500 days, we talk a lot about we're almost there. But as Alan said, if we take our foot off the goal, if we take our foot off the pedal, we can lose momentum very, very quickly, and we relapse incredibly quickly. Madagascar is a case in point. They didn't have enough money for bed nets for a while, and we saw a resurgence in the epidemic in the eastern side of the country. So we really need to focus on that, and we need to work with the communities. We need to work with community health workers. We need to ensure that we're increasing access to treatment. And for us as UNICEF, it's really about that holistic package. We know that the top 3 killers of children are pneumonia and diarrhea. So we're very much focusing on integrated community case management, on scaling up use. Because as we're working to ensure that there is prevention, that there are bed nets going out, we need to ensure that they're being used. And that's a lot of what UNICEF spends our time on, is on behavior change, communication, on training community health workers, and ensuring that we're moving forward, and then working on the back end, because part of getting to the MDGs will be reporting on the MDGs. So ensuring we have good surveillance data, we have good rapid response mechanisms, and that we're ensuring that we're tracking our progress and reporting that back, because that will help keep up political will.
Great. And a common theme, I think I've heard it from all 4 of you, or at least 3 of you, has been the idea of partnerships. The MDGs have given partners the opportunity to rally around a specific and consistent set of goals, and the partnerships between UN agencies, the U.S. and other governments, NGOs, multilateral institutions, working around a same agenda has I think been really key to achieving progress. I don't want to point to any of you. I think I would love it if each of you or most of you weighed in, but can you speak to, in your own work, the power of partnerships and maybe a story or two in terms of how bringing together partners to tackle these big problems? In the case of MDG 6, it's HIV/AIDS, it's malaria, it's tuberculosis, and other diseases. How important are partners and the idea of institutions coming together in this fight? How is that led to success? And also, do we need to be doing more of it if we're going to reach our ultimate goals?
Happy to start if you want, Chris. I think partnership is absolutely essential for that, and we have already mentioned a couple of partnerships here in practice, and all of us on the panel are working on that. But let me mention two that we have not mentioned. Together, actually, with the UN Foundation, we also partnered, I think for the first time, with some of the faith-based organizations in the US on working on malaria. You helped to facilitate a partnership with the United Methodist Church, with the Lutheran Church. We're working in a number of countries with them because they are quite essential. Also mobilizing their communities and their membership in those countries so that bed nets are not only paid for, but they are used and the people have the right information. And also the partnership with the private sector is absolutely critical. And just to mention one of them in Southern Africa now partnering with Nando's, with a big kind of restaurant chain, and they have created a malaria campaign, mobilizing money, because I think it's also important to look at the resources mobilized from the countries now that complement what we can do as international funders. But I think it's all about partnership. That's the only way how we can hope to achieve the MDGs and go beyond and really go towards the elimination of these diseases.
Yeah, Chris, this is Tim. Let me jump in. I agree. When you have a major catastrophe or a major problem or challenge, typically there's no one individual, no one country that can take it and have a successful outcome. And as we all agree that the accomplishments of the last 10 years has been a great example of different partners coming together to achieve a common outcome. I think it's important that we embrace the idea that the most important partner is the country itself, that those of us who are funders or technical providers or advocates come together. The platform is the country. Each country is different, and all the funding mechanisms, all of the technical assistance capacities vary, and where they are on the spectrum and the timeline of moving towards 500 days and beyond is different country by country. So I think as a partner, we make it very clear that it's important to be an effective partner working towards a common set of outcomes. And I think those of us on this panel all are in total agreement with that. The United States government, through the President's Malaria Initiative, have over 200 partnerships with nonprofits, of which 30% are our faith-based partners. So it's essential. We can't get where we need to go without effective partnerships, both on the public and the private sector.
So, Chris, let me come in here, just
Sure.
A bit more on the same thing. I think from the Office of the Special Envoy, our mantra really is when we go to a country and we talk to the country leadership is how can we support you?
Mm-hmm.
And then how can we get the whole community, if it's not already doing so, and often it is, come around to actually address the problems that are placed on the table. So figuratively speaking, you have the problem on one side of the table and all the partners, including government, led by government, on the other side of the table, addressing the problem. And this is the way that we see it, and this is the way we feel it needs to work. You asked for one example, perhaps. One I can think of, and Valentina will recall this because she was instrumental in it. There's the person who used to run the National Malaria Control Program of the Democratic Republic of Congo, DRC, Dr. Benjamin Atua, pulled partners around the table, and Valentina was one, and said, okay, we're going to have to do this, but we can't do it all at once. How are we going to work province by province, and how can we work with each one of you to make sure the provinces actually get covered when they need to get covered? Just a brilliant example of how an individual took that leadership and helped move things along, so a country the size of the whole of Europe could actually address the problem of malaria, being a highly endemic country with very little infrastructure, few roads and other means of transport, and yet they managed to get tremendous results. So I'd stop there, just one example.
Great. And Valentina, I don't know if you have anything else to add. You don't need to. But so here's a question. So obviously the fight against malaria will continue beyond 2015. In keeping with the themes of partners, what are the lessons learned or the successful, the positive partnership energy? How do you see that maybe being brought together and being used, to reach all of our eventual goals? The total defeat of malaria in a world in which no child has to die from this preventable, treatable diseases. I mean, partnerships are at the center of not just the next 500 days, but the future of wiping this disease away. Correct?
Yeah, Chris, let me jump in. First of all, I want to punctuate what you just said about what happens at the end of the 500 days. We're all in the business of eliminating malaria as a major burden or a major global public health problem. So after 500 days, we still have an awful lot of work to do. And again, we cannot do it without effective partnerships. A lot of people talk about partnerships. We all raise our hand and say we're in, but at the end of the day, effective partnerships at every level takes a lot of hard work. It takes commitment. It takes understanding on where on the timeline and the work plan that you are able to enter. How do you measure the impact of your investment and what the exit plan is, depending on who you are as a partner. In the United States, we have a requirement to partner within our own U.S. government agencies. And so we spend a lot of time. USAID is the lead malaria agency for the U.S. government's malaria program, but CDC in Atlanta is a co-implementer of that in the field. At the same time, FDA, our Peace Corps with over 1,000 volunteers, and FDA and NIH are part of the U.S. government partnership that comes together as one, as a partner, then to align with our other funding partners and with our other technical partners and the private sector. So it's a very complex issue. We can't move forward and achieve our collective goals without effective partnerships. But in my time as running the President's Malaria Initiative, there's more rhetoric than there is positive results on effective partnerships. And I think this is something that we got to continue to work on, define, and figure out how to effectively move forward on enhancing our power and capacity as partners working on behalf of the countries.
All right. Now, are you optimistic on the future of this fight?
Yes, I'm not only optimistic, but I'm motivated by the fact that it's absolutely essential to come up with an effective commitment by all of the partners. working towards a common strategy. And in the malaria community, we're blessed. Underneath the banner of the Rollback Malaria Partnership, we're shaping a global malaria action plan, which is the second iteration of the first one that RBM and the partners put together, which is building on WHO's global technical strategy. And when that's launched next year, at the end of, or about the time when the 2015 anniversary hits, it then will give us a global vision and a framework by which the partners can come together and address funding requirements, gap requirements, look at innovation requirements, and start or continue to work together in a more effective way. So I'm hopeful.
Now, Valentina, Alan, Christoph, are you equally optimistic with Tim? Do you have anything to add to this question around, you know, your optimism around partnerships and how they're going to fuel the post 2015, you know, fight?
Hi, Chris. Yeah, no, absolutely. I mean, for us as UNICEF, we do a huge amount of work with local partners, with local NGOs. I think the Admiral put it best when he said, you have to craft a country strategy country by country. Each one is going to be very, very different. And as we're heading into an optimistic but still resource-constrained environment, we're going to need to tailor our strategies in a different way. So look at situations where we might need to stratify, a little bit like the example that Alan gave about what can we do first and how do we build on that and how do we use the money we have now to build on different modalities. For us, we're doing a huge amount of work on using integrated platforms which can kind of cost share and look at different ways. And I have two fantastic examples, both of them from the DRC, which, as you can see, I care for very much. But it's also one of the three major burden countries where we need to do most of our work to get malaria cases and malaria deaths down. So one of them was an integrated campaign where we delivered polio, measles, nutritional supplements, and deworming, and bed nets. And it was a fantastic campaign because it really got people motivated about looking at the holistic package and the life spectrum of saving kids' lives, but also sort of helping give messaging to their parents. The other was, again, as I think Christoph mentioned, is using community leaders, using faith-based organizations. So we had a project in Katanga province where we worked with all of the major faiths and had them give the message to their communities about life-saving messaging, exclusive breastfeeding, hand washing, using your bed net. And that has one where when a community talks to yourself, that's the kind of partnership that will help us get us towards our goals.
That's great.
Chris, let me come in here. And I think really as we look forward, first we have to look back a bit. One, we've spoken about certain successes, but when you look at success of, say, measles vaccine, which has reduced measles deaths in the last 15 years by something like 90%, from the half a million deaths there used to be in 2000 to a fraction of that now. When you look at that, when you look at what we've spoken about here on this panel, what is it that we need to do going forward? Number one, we do need a financing boost. There's no question, both to actually achieve the goal by the end of next year. There's still gaps. We still need to fill that. And that will give a proper platform for the next period, the next 15-year period. Otherwise, we'll still be scrambling to catch up. So we really need to make sure that that gap is filled. Secondly, we have to commit to the lives saved. Just on MDG 4, the fourth Millennium Development Goal on child mortality, we have to, next year alone, save an additional 2.2 million children's lives, lives of children under 5 approximately, from the 6.5 or so million that are estimated to have lost their lives this year. And so how do we do that? We need to focus on what is it that saves those lives. We've spoken about some of those interventions. Thirdly, though, and this is where the partnership idea comes in, we shouldn't not miss any opportunity. So whether you're a donor government, an endemic country of any kind, a country with a particular problem, an NGO, any civil society or faith-based organization, what are the opportunities you have, even as an individual, where you can intervene today tomorrow with your representatives or whomever to make sure that we miss no opportunity in actually achieving the goal in 500 days' time, so that the next phase is off to a really good start.
Great. And Christoph, do you have anything to add? All right, I'll take that as a no. So again, this is for any of you. I just want to open it up. What are each of you most excited about in terms of new technologies, tools, other interventions and ideas that could get us that much closer to achieving these goals in the next 500 days and beyond?
Yeah, Chris, let me take an initial go at that.
Great.
I think we need to face reality. 500 days is just around the corner. And I don't anticipate additional funding that's going to be in the pipeline and programmed in order to make any significant shift in the lives saved or achieving the goals. So what we have right now needs, as Alan mentioned, we need to be looking at each opportunity, each dollar, each bed net, and make sure that we get the biggest impact on that. We are fortunate in the malaria community to have proven effective interventions. So between now and the next 500 days, we need to not only use them, but then protect them and preserve them, and make sure that we don't see an erosion of those effective interventions. For instance, the parasite and the mosquito are pretty widely enemies, and they're building resistance, and the threat, of course, is neutralizing the effectiveness of insecticides in the bed nets and on the walls, as well as compromising the effectiveness of artemisinin in the ACTs. So we need to not only use the current interventions, but preserve them. This whole resistance piece is a critical fault line lying ahead from now and beyond 500 days. I'm really pleased that the partners have come together and invested with our private sector in product development partnerships with malaria ventures for, let's see, MMV, IVCC, which is the Integrated Vector Control Consortium, and PAP, all pursuing improved anti-malarial drugs, improved insecticides, and looking at accelerating the vaccine options. So until those new products hit the market and can be applied after the 500 days, we've got to make sure that we're good stewards to the interventions that we currently have.
Sure, and for Alan, I assume that you agree with Tim. Are there other tools or interventions, that are upon us or are almost upon us that you think can be game changers?
Yes, it won't help us, as Tim says, in the next 500 days, but certainly the investment in them in the next 500 days will help find solutions later. Just one example is there are several different molecules now being studied to provide a single encounter or single dose treatment for malaria. So you only have to take this once, not twice a day for 3 days. And that means the likelihood of compliance is so much higher, which means it might stave off resistance to that drug a bit longer once it's in play. And I think that kind of thing is good. Another kind of technology that's been developed in South Korea and Brazil is actually providing drugs like you do a breath freshener, a little film you put in your mouth and it dissolves. And just little things like that that are out there, they're being investigated, they're being tested. These things provide hope that not only can treatment become simpler, but also much easier to administer and take for yourself and self-administer over time. This to me is really exciting because if we do what Tim says, is not take our eyes off the ball, keep the pressure on the parasite and the mosquito to make sure that we don't see any resurgence in malaria, we might be able to break the back of the disease over the following 15 to 25 years.
Great. And Valentina, is there anything from your perspective, both someone who's on the ground but representing a great UN agency?
Yeah, no, absolutely. I think it's as Tim and Alan said, there's great things coming down the pipeline. We have to protect those, but it's going to be small fixes now. We have to look at the missed opportunities. We have to look at protecting the rational use of ACTs through treatment of the febrile child. We have to break that mentality that, especially in Africa, fever means malaria and vice versa. So ensuring that people respect their RDT diagnosis, that they use integrated community case management through community health workers because it's closest to the community, so we can ensure that we're parceling out the ACTs in a rational way, that people respect, again, a negative diagnosis. It's also small fixes, say it's working on the supply chain to ensure that they're getting out there to the most marginalized, to the most poor, to the most rural communities, and then working on things like mHealth. It's extraordinary, the explosion of phones all over Africa. Most people have mobile phones. In the DRC, you don't have landlines. Everyone has a mobile phone. So teaching people to use simple technologies like this to report back, where are the cases, where do we have to have a rapid response in order to hit the epidemic? This is, I think, what's really going to get us, is improving data quality and data management to ensure that we are getting closer and closer to the goal, and that we're targeting our resources to where they are needed most.
Sure. And I mean, just, hearing your, all of your, thoughtful responses to this, and hearing what each of your organizations is doing is particularly uplifting. And from the perspective of Nothing But Nets, we're a really proud partner of what each of you are doing. And speaking again to the power of partnerships, to feel like the resources that we're able to send and are being put to great use and are reaching families, and the people are being thoughtful, our partners are being thoughtful in terms of what's next and what can make the biggest difference. I think it's uplifting to hear. And we're obviously not being viewed today exclusively by partners, but by a collection of individuals all over the world. And can each of you talk about, for the audience that's participating and following the discussion online, what's just one thing, and maybe I'll let you do two things, but really, what's one thing that each person out there listening in to this chat can do to help fight this disease?
Chris, your organization, Nothing But Nets, started out in a partnership with the National Basketball Association in the US, the Sports Association. Much later, when the Soccer World Cup was in South Africa, United Against Malaria started working with soccer teams around the world. This kind of partnership shows that it's every kind of partnership that can get involved, can be active, and so on. So for people who want to get involved, you can write or call a representative, your parliamentarian or congressman or whomever. That's one thing. But you can work with celebrities. You can work with your favorite sports club. You can do all sorts of things to get involved. You can work with schools. Education is key. People need to understand what's needed. Work with schools. Plenty of things you can do depending on the time you've got and your inclination to be able to intervene. So I would say the opportunities are out there, seize them.
Great. And Valentina, what's that one thing someone out there listening can do to help the work that you're doing at UNICEF?
I would split it into two different categories. As Alan said, there is talk to your representatives, make sure that our Congress is aware, the U.S. Congress is aware that the Global Fund is getting resourced, that money is coming through on that side. So in the developing world, make your voice heard, ensure that contribution is going heard. And then on the other side, I would say in malaria endemic countries, again, make your voice heard. You have the right to demand access to bed nets. You have the right to demand equal treatment, the right diagnosis to be treated for whatever condition you have. So I would split it into those two ways. Everyone in a malaria endemic country can become an advocate for their best protection, that they can help us also help them.
That's great. Thanks, Valentina. And Tim?
Yeah, Chris, you asked for one thing. It's impossible for me to do one, so I'm going to sneak in three. I think Alan is exactly right, Valentina, in that this is an individual thing, and anybody, once they understand the impact that malaria is having around the world, can make a difference. All of us have been introduced to young men and women coming through the Boys Club, and are just wowed by the fact that they have raised thousands of dollars for bed nets and channeled them through organizations like you. An Eagle Scout raised over $20,000 for bed nets to channel through programs like yours. I just met an individual 2 weeks ago who has worked with you, Chris, Dr. Simon Estes, who is a world-renowned opera singer who has sung in every opera house around the globe. He has sung before our presidents, he sung before the Pope, and he sung at the World Cup in South Africa. And he's interested in raising money and not collecting a penny, but raising money through his voice and through his performances to provide resources to save lives. And after my 45 minutes with Dr. Estes, I was inspired because he represents hundreds of thousands of people who get it and are interested in saving lives. And I just piggyback what Valentina said. All of us need to not necessarily raise money, but we need to understand and get engaged and know that we can make a difference either by calling our representatives, our senators, or our churches. When you look at what the Methodist Church has raised through their youth groups and their mission programs, it is significant. And so I'm inspired by the individuals who are involved to help all of us achieve this collective goal of making malaria or reducing malaria as a public health burden around the globe.
Yeah, and I'll say with the example of Simon Estes, the opera singer, he was actually an introduction to us from the Gates Foundation, who's another terrific leading partner in the fight against malaria. And yeah, that was not a softball to say get involved with Nothing But Nets, but we have found whether you're an NBA star or an opera singer or a CEO or a second grader, there are lots of ways to get involved. And Tim, we talk about this theme of advocacy and in the U.S., calling your representatives to make sure that the support for critical malaria programs is there. Is that government money well spent?
Yeah, Chris, thanks. That's an important question. And I would like to say, and of course I'm prejudiced here, but the U.S. government's malaria program is recognized as a successful U.S. foreign assistance program, but it complements what President Obama has stated in the State of the Union address, that the U.S. government is committed to alleviating extreme poverty over the next 20 or 30 years. As Valentina said so well, the good malaria prevention and control contributes not only to MDG 4, 5, and 6, maternal child health and reduction of infectious diseases, but directly into education. Kids that aren't sick go to school, and kids that aren't sick and moms that are working alleviate poverty at the community level and reduce the burden, economic burden that malaria has. Americans do understand that, and the point that I like to make is that not too many Americans call their senators and congressmen in order to encourage them to vote for malaria. Okay, so we have an opportunity as citizens to say we want to make sure our foreign assistance dollars are having an impact. And I think when you look at global health around the world with our partners, the dollars invested in health, in HIV, in TB, in neglected tropical diseases, maternal and child health, and malaria all come together to make a pretty compelling story that we're getting a huge return on our investment in the foreign assistance programs. So American citizens, once they hear that, are able to turn that around and acknowledge the commitment that our Congress is having when they appropriate dollars for the foreign assistance, particularly the public health accounts.
Yeah, and we message to our hundreds of thousands of supporters at Nothing But Nets, the importance of raising your voice and making sure that entities like the President's Malaria Initiative are well funded, and when we are out there communicating to our various audiences, you oftentimes see the light bulb go on and people think, oh, it's just that big, that big a part of the federal budget, and it makes that much difference. What an incredible investment, and we're obviously a proud partner, Tim, of what you're doing. I want to be aware of time. We've only got a few minutes left, and so Alan, Valentina, if there's final words from
Hi, Chris.
I don't know if
Hi, Chris. Sorry,
you.
the problem of connecting from Madagascar, but it was just to thank you for this and to really it's been a pleasure and a privilege to be part of the panel and to represent just the tiny tip of the iceberg of what UNICEF does. For us, it's incredibly important because we cover the whole life spectrum, and it's really wonderful to be part of an MDG panel that will show how malaria contributes to all of the MDGs. It's partnerships, it's alleviation of poverty, it's education, and for us it's incredibly important. So really grateful to you and grateful to my fellow panelists.
Yeah, Chris, from my side, thank you very much, and thanks Tim, Christoph and Valentina as well. The next 500 days are going to be very busy, and I think we've said several times, no opportunity should be missed. And we all need to really get to work and make sure that we get as close as possible to achieving those MDGs with the tools and resources we have, really set up for breaking the back of malaria in the next period of time.
Yeah, no, I think that's very well said, Alan. And we lost Christoph, sometime 15 minutes ago. But I want to say thank you to each of you for being on the panel. I think your participation today is great. But what's so much bigger, for us at the UN Foundation is, and I've had the opportunity, thankfully, to work side by side with each of your organizations, and I've been on the ground in sub-Saharan Africa with the President's Malaria Initiative, many times with UNICEF. And the work that you're doing is transformational. And so just, on behalf of Nothing But Nets, please, accept my gratitude. We're thrilled to be able to align ourselves with people and organizations who are doing such incredible work. So, thank you, yes, for participating today. I think it was a really fun discussion and highlighted the progress that's been made. But for the work that you do day in and day out, thank you very much also.
Thank you.
Thanks, Chris.
Bye, guys.
Bye.
Bye.